Welcome back. Thanks for joining me on this module. My name is Mike Minokian. In the last section, my brother Dave and I talked to you about the details of our comprehensive exam and the overall office experience that surrounds it. In this part, I want to discuss with you filtering patients into the right exam. This section will be broken into three separate parts. The first, talking about the boundaries we established as a practice to help our team schedule patients for the proper exam. The second part will focus on the team actually talking to patients about the complexity of the examination, how those discussions actually sound. Finally, the last section will talk about how we as doctors need to be able to simplify how we deliver the exam, depending on the patient's interest level. So when we first rolled out doing this very comprehensive exam, we wanted to maximize the amount of new patients that got to experience it. The reality is, if we left it up to the front to try and filter the type of visit a new patient would need, based on what the patient said over the phone, many of those new patients would be brought through hygiene first. The only filtering that we really left up to our front was to determine whether or not the patient had an emergency situation that needed to be taken care of prior to doing a full exam. For instance, if a patient has a broken tooth or is in pain and wants to address that first, we're perfectly fine with that. Those types of patients will receive a very basic emergency exam so that we can evaluate their problem area. After that, we'll either do treatment on the tooth or recommend the patient return for the full evaluation. Again, our experience with giving the front full control is that typically most non-emergency new patients would come in for a cleaning and we'd get to only do about a 5 to 10 minute exam, typically between patients, and ultimately the value that we could create when discussing comprehensive dental care would be minimal, because in our patients' eyes, we're really no different than any other dentist they'd been to in the past. And this brings up a major point I want to get across. One of our main goals in this implementation process was to be different. When patients sense a difference, they start to open their eyes and their ears to a different approach. So what we did when we set up boundaries was we set up age requirements. Any patient over the age of 30 and under the age of 75 would receive a full comprehensive exam at their first visit. 30 minutes with the assistant for radiographs and 6 photos, and 40 to 50 minutes with the doctor. We do this because I can't tell you how many times a new patient calls or presents and just isn't aware of what they have going on. Unfortunately, when they're unaware of their conditions, they're also typically unaware that they could benefit from a full exam. When we first started doing it this way, we made a pretty strict policy that the exam would be separate visit from their cleaning. And we did this for 2 reasons. Number one, we believe that it's our responsibility during the exam to figure out what type of cleaning the patient actually needs. Do they need a prophy, a debridement, scaling and root planing? Do they need to be referred to a periodontist? The second reason we did this was due to scheduling. Truth is, it could be tough to find time in our schedule for a long doctor exam followed up by a hygiene visit. Pushing a new patient's appointment out a few weeks can sometimes demotivate a patient, and sometimes you run the risk that they'll call another office to schedule so they can get in quicker. More recently, we started giving patients the option: get in quicker for the full exam with the doctor, but without a cleaning, or wait a couple weeks to get the appointments doubled up. When we took the approach of only doing the exam at their first visit, in reality, 9 out of 10 times the patients were fine with it. Unfortunately, some people, they did feel like they were caught off guard. This is what ultimately led us to make a change and give patients options over the phone. In the second part of this module, I want to discuss with you how the team actually talks to new patients about their initial exam and their experience. So let me explain. See, I'm a big fan of the innovation of Steve Jobs. He made it a point in all of his presentations to really simplify things, kind of like Frank Spear does. When Steve Jobs introduced the first iPod, he didn't talk about the memory or the graphics card or the battery power. He came out and said, 1,000 songs in your pocket. It was catchy, simple, and it made people want to buy one. It was a short and yet very powerful message, cutting out the complexity of the product, sticking with simplicity. In the beginning, when we first started implementing the more comprehensive exam, our team would go into way too much detail, explaining the exam that the new patients would receive. I mean, they'd talk about the TMJ exam, the muscle exam, the occlusal exam. They'd even emphasize the fact that the patient wouldn't get a cleaning at their first visit. Honestly, this left many of them saying, well, I don't need all of that. I just want my teeth cleaned. And this led us to a follow-up meeting about the 1,000 songs in your pocket concept. We wanted the team to come up with their own 1 or 2 sentences that would express the value that our patients would receive at their first visit, not focus on the specifics of the exam or the negative that they won't get a cleaning. Something like, your first visit will be with Dr. Mike. Doctors in our practice prefer to spend about 40 or 50 minutes with you at your first visit. They like to be very thorough and get a good baseline for your overall dental health, and at the same time, help you understand your current condition. It's a great opportunity for you to get any and all of your questions answered. This simple change in language and delivery seriously improved how our patients receive the message. Now, they don't hear about things that they may not think they need. They only hear positives. Explain the benefits of the approach and avoid being sucked into excessive explanation. This gives patients something to be excited about, rather than something that they may dread. The reason this is so important is because, like we discussed in the previous module, people have certain expectations about their first visit. Patients referred in from other patients or from specialists may expect this detailed approach. On the other hand, patients come in because they saw our name in the phone book or found us on Google or drove by and saw our sign. They may not expect this comprehensive exam. It's so important to clarify what our office is about and how we approach new patients, again, sticking with benefits. Now, when it comes down to actually performing the exam, the reality is we check a lot of things. And the truth is, a lot of patients love it and love all the explanation behind every part of the exam, and some just want to get through it and get to the recommendations. That's where the complexity of performing the exam comes into play. In our opinion, there's 4 types of patients that can get the comprehensive exam, and they're separated by the patient's interest levels. Some patients show a lot of interest while others seem totally disengaged. The reality is, the ones that are uninterested are typically this way because of 1 or 2 reasons. Number 1, they're totally unaware that they have any problems to begin with because nothing's really bothering them. Or number 2, they know they have problems, they're just not really ready to do anything about them. With that said, let's look at the 4 classifications of patients and how the exam may differ. The first patient is a person that's uninterested in the exam and needs very little work. This is the type of patient that we still do a thorough exam, however, we may move a little quicker, not get into too much detail about every step in the process. Typically, this type of patient can have all of their problems, consequences, and solutions explained right there in the treatment room with the aid of the 7 assistant photos. Moving quicker makes these patients happy. If we sit there and go into too much detail, they get bored, especially if what we're explaining has very little meaning to them. The second type of patient is one that's still uninterested in the exam, however, significant dentistry may be needed to get them to full health. This is usually a patient that comes in completely unaware of their current condition, but it's our job to make them aware. So in this situation, we take the time to really explain the importance of the different steps of the exam and how it's relevant to them, really stressing the relevance. For instance, in the beginning of the exam, we ask the patient if they're aware of any clenching or grinding activity. Some people say no, even though the assistant photos show some clear evidence of attrition. We don't tell them they're wrong and actually they do grind their teeth. Instead, we use different portions of the exam to start to tell the story. For example, when we palpate their muscles and maybe feel some masseter tenderness, we tell them that overworked muscles are typically sore, just like if you went to the gym and overworked your biceps. This helps to start raise awareness that something may be going on. Why are my muscles being overworked? When you start adding more and more pieces to the puzzle, patients start understanding. Another example may be someone that tells us that they have a history of not sleeping well. We check them out and they're skeletally class 2, they have a restricted palate, and they have evidence of anterior tooth wear. We use things like bite effects and spear education software to help explain how airway issues can be the result of a retrognathic mandible and mouth breathing. We also relate it to their tooth wear. All these things start to raise awareness for someone that was completely unaware. If any parts of the exam aren't relevant to the story you want to tell, try not to focus on it. Sometimes focusing on the unimportant details can make a patient shut down and not listen to anything else you're saying. The reality is, if a lot of things are going on, it can be difficult to summarize everything at their initial visit, especially if you sense they're uninterested. To fix this problem, a lot of times we'll do what we call a mini consult. We get the patient back for a cleaning or maybe a filling or 2, and at that visit, we make sure we schedule another 20 or 30 minutes to really sit down and dissect their problems, consequences, and some solution options. We need to at least make them aware, and then from there, they have control about how they want to move forward. Sometimes during that mini consult or even during the initial exam, we'll recommend a full consult. For that, we'll typically take 17 photos and get diagnostic models and bite records. Sometimes we have time to get these photos and records at their initial visit, and sometimes we need to schedule them on a separate day and time to get it done. Spending more time with these uninterested patients, that's the key. Again, they're most likely unaware to begin with. The more things that we can show them that make sense to them, the more interested they usually become. If we try to rush these conversations in one visit, we're typically unsuccessful because a lot of times it leads to the patient being confused about their options. The next type of patient is someone that's interested in the exam, however, they have little work that's really needed. These patients are easy to navigate through the process. We get to explain to them everything we're doing using BiteFX, the TMJ tutor, or the Spear patient education software. Even if they have very little going on, it's fun because we're excited to do a thorough exam and they're happy to receive it. We can usually summarize all of our findings quickly and develop a treatment plan with maximum patient input right there at their first visit. Finally, the last patient is one that's interested in the exam and they need a good amount of dentistry done. Again, these are patients that are easy to talk to. We take time to tell them what we're doing and what we're looking for and how it impacts them. We explain all the problems, consequences, and solution options. But again, similar to the uninterested patient that has a significant amount of problems, these patients are the type that we may consider getting back for either a mini consult or a full consult. These consults give us time to really gather our thoughts and tell a good, accurate story of their current condition. It's an opportunity to simplify things for patients, make it so that they understand all of our findings. Confusion leads to patients that just don't commit to doing dentistry. I hope that explaining these 4 types of patients helps you to understand that the exam doesn't change, because the exam is what helps to show the patient you're different than most. Just the approach with the patient changes. Some we can move through quickly, some we need to move a little bit slower. Identifying a patient's interest level helps to shape how you should approach your presentation to them. I'd like to thank you for joining me on this module. In the next section, Dave will discuss with you how we approach talking to existing patients about the comprehensive exam. Hope to see you again soon.